All right, back with WMAY's Morning News. I'm Greg Bishop on 92.7 WMAY. Springfield's news and talks, of course, COVID-19 dominating our lives the past 2 years on a variety of different fronts. Your kids weren't able to go to school for a huge chunk of time when they played sports. They had to wear masks. Maybe you didn't get to go to work as you may have wanted to because of the stay-at-home orders. So there's a lot going on when it concerns COVID-19 and mitigations that were part of the overall efforts to try and limit the spread of COVID-19. If you remember, it was 2 weeks to slow the spread, and a lot of questions about the different types of mitigation policies that were implemented by Governor J.B. Pritzker and beyond. But yesterday, an interesting day with an update from the Centers for Disease Control and Prevention on data and how that's being reported. But you also have another report that comes out concerning states and various grades that they received. So we're going to unpack some of that today here on WMAY. And we'll start with the issue of COVID-19 restrictions that ultimately we're not necessarily going to see in the future here. The Illinois Department of Public Health holding a news briefing yesterday to update people on the new COVID-19 metrics, how they're being reported. So if you've been following the COVID-19 numbers on the Illinois Department of Public Health website, you're likely going to see that change. And we've seen that evolve over the past 2 years substantially. And the change, I remember watching hospitalization numbers that seemed to be early on when I was looking at all the data, trying to find out exactly what the hospitalization numbers were, and then watching how that evolved over time. And I remember at one point, too, there was a set of numbers that I was collecting myself from IDPH data to compile and try to show a trend of sorts. And as I was reporting that out, IDPH seemed to kind of evolve some of their reporting. They looked, of course, to experts all over. And the numbers were total number of tests taken, total number of positive tests, the case rates, the R naught number. And then we had it all split up into different regions and just an amalgamation of just data overload. Right? That's something that seemed to happen throughout the pandemic was we were getting inundated with data. And what exactly that data meant, we didn't necessarily have all the context and how that data was being used to make decisions on mitigation. If just the layperson was hearing about it in the news and hearing case rates, you can kind of see how that may have impacted their psyche, their understanding of the status of the pandemic, and so on. But here we are now, 2 years into it. We've got vaccines available, we've got therapeutics available, and the Illinois Department of Public Health announcing that they're going to be adapting to what the Centers for Disease Control and Prevention has to say when it comes to reporting these things out. So here is some of the conversation yesterday during a news briefing on just exactly what the Illinois Department of Public Health is doing to conform with the COVID-19 reporting that they're going to be doing at their website. So here is some of that from the Illinois Department of Public Health acting director, Amal Tokars. And she laid out there that the Centers for Disease Control and Prevention changing some of their reporting, and IDPH is going to follow suit.
In response to changes implemented by the Federal Health and Human Services and the Centers for Disease Control, the state of Illinois is adopting new federal guidelines for tracking COVID-19 at the community level to determine the community level of COVID-19 and to classify it as low or medium or high. These are the three metrics. First, total new COVID-19 cases per 100,000 population in the past 7 days. Next, new COVID-19 admissions per 100,000 in the past 7 days. And finally, the percent of staffed inpatient beds occupied by COVID-19 patients. But the risk from COVID-19 remains significant for some sets of our population. These include older people and those who are immunocompromised and persons with disabilities.
If there are mitigations that are anticipated, will the decisions be made on a statewide or a regional basis?
I did hear that in the question, and I have something else I want to say after the answering that, because I know we're out of time, Lori. But we are not discussing that at this time. So we have not discussed mitigation at this time. So if we do discuss it, that's a determination yet to be made.
So again, that's some of the news briefing, and you heard there new numbers are going to be reported, how they're reported out, and exactly what context those numbers will provide for future policies. And the question was raised of what about future mitigation? And IDPH said, as of right now, the CDC lists Illinois as a low transmission states. So the mitigations aren't being considered at this time. That doesn't mean that they're not considering them in the future. And we've even heard Governor J.B. Pritzker in the past indicate that he'll watch the numbers, and depending on what the numbers say, he could take action one way or the other, but didn't really provide much clarity. So we'll definitely keep an eye on that space. But one thing also to consider is how Illinois fared with all of the COVID-19 metrics and situations and health outcomes. So we'll hear next from one of the researchers of a study that delves into three particular variables to judge all the states and how they did with COVID-19. And those three variables are health outcomes, economic outcomes, and education outcomes. Illinois got an F. We'll unpack as to why coming up next here with WMA. Illinois got an F for COVID-19 outcomes in a new report that highlights how the state ultimately fared when it comes to COVID-19. And I think it's something that you've got to be sure to better understand and reflect upon. Now, this report highlighting all of the various factors that there are concerning the outcomes of COVID-19 looked at education outcomes, economic outcomes, and more. So what we have here is the report from the University of Chicago economist Casey Mulligan, Stephen Moore, and also Phil Kerpen, all a part of this organization that is unpacking these numbers and giving Illinois an F. And this is from the National Bureau of Economic Research, looking at all 50 states and the District of Columbia. So I talked with Casey Mulligan yesterday, and he is one of the researchers involved in this report. And the report, again, kind of just reviewing all of the states and all of the different COVID-19 metrics that they had. And it highlights how, again, states with more strict lockdowns, they had worse outcomes when it comes to education, when it comes to economy, and so on. So again, you can see this report. It's a working paper, and it breaks down all of the various indicators. But I talked with Casey Mulligan yesterday and got an idea of what exactly Illinois looks like in their report. So here is some of that conversation.
Maybe surprisingly, there's a lot of differences across the states. We all had a pandemic, but a lot ended up being different. And Illinois came out low on schooling. It came out low on the economic variables, has a high unemployment rate compared to the nation, and low GDP growth compared to the nation. And they didn't really get extra help for that. Maybe their mortality is a little bit above average. And so when we combine the three into a combined score, Illinois comes out in the bottom 5 or 6 out of the whole country.
And again, Illinois getting an F in this paper. And it's something that also brings up the question of what exactly the takeaway is. What's the takeaway of this research that shows that more restrictions, keeping kids from school, doesn't help the economy and didn't really impact health in a positive manner, possibly even hurt health. I asked Mulligan what some of the takeaways that policymakers and the public should take from this report.
Well, the obvious thing, probably the public already knows it, and our study would just reinforce that. Closing the schools didn't make any sense, except maybe from the teacher union point of view, but from the point of view of the rest of the people of Illinois, it hurt the children and it didn't help health. Might have even hurt the health a little bit, but definitely didn't improve health, didn't reduce COVID or anything like that. That'd be number one. Number two is that cutting back on economic activity doesn't seem to improve health that much.
Now, as far as the idea of what a lockdown is, Mulligan did say that you have to be careful with that word, because lockdown doesn't just mean a government order to stay home. It can also be the mentality of the public and how, say, a policymaker or a public figure may add to that mentality of locking things down.
Narrowly, as being just the governor writing orders and putting his signature on it. That's part of it, policy and laws, orders. But the other part is just the people deciding to lock themselves down and being timid or fearful or cautious. I don't need to put a pejorative term on it. And the states were different in that way too. The people in Wyoming just weren't too interested in giving up normal life. And so their economy boomed, even regardless of what their governor was doing. Now, governors did influence that in terms of emphasizing, what they emphasize shows they emphasize. And certainly the Illinois governor was kept talking about health and health risks and deaths and, helping reinforce the fear that people had. And whereas your Wyoming governor wouldn't have been doing that reinforcement.
So again, this report's a final report card on the state's response to COVID-19 from the National Bureau of Economic Research. And topping the list was actually, let's see here, number one, Utah. Utah getting the top spot with an A+ ranking. Illinois, sixth worst with an F. So I think that's just one review. Now that we have all this data from all these states, we need to compare and contrast to see if policies moving forward should not or reflect what we did in the past. It's now 7 o'clock.
From the Fly SPI studio, take the